Bonjour tout le monde. Hello, everybody. Welcome to today's online N4 webinar, Welcoming Internationally Educated Nurses into the Canadian Healthcare Sector, Recommendations for Change. And before we begin our presentation today, we would like to begin with an acknowledgement that N4 is hosted at CHEO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin and Anishinaabe territory, and the peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis people, and their valuable past and present contributions to this land as well. My name is Andrew Thomaier. I'm the Education Coordinator at N4. I go by the pronouns he, him, and I'll be hosting and moderating today's presentation. Along with me is my colleague and co-host, Colleen Drake, N4's Project Engagement Coordinator, who will be monitoring the Q&A box today. I'm now pleased to introduce you to today's presenters, Joyce Kristjansson, Jennifer Lopez, Dr. Edward Cruz, who may not be available today, and Mariah Maddock. Presenters, I'm going to ask that you turn on your video as I introduce you. Joyce Kristjansson is an RN with over 40 years of experience, which has included nursing in urban, rural, and remote areas across Canada. She's been involved in clinical practice education and research. She has an MBA and has spent most of her career in health service management. She's currently the Executive Director of the Association of Regulated Nurses of Manitoba, a member of the Board of Holy Family Home, and Chair of the Board for Manitoba's Association of Community Homes for the Elderly. She's a strong advocate for the profession of nursing and for use of the skills of internationally educated healthcare professionals in the Canadian healthcare system. Jennifer Lopez is the president of the Integrated Filipino-Canadian Nurses Association. She has over 20 years of experience, and she was a registered nurse at Unity Toronto Hospital and is now a patient care coordinator. At George Brown College, she received an academic pathway for international nurses graduate certificate, and at Humber College received her RN and RPN certification. Jennifer's currently chairs N4's IEN consulting group. Dr. Edward Cruz was to be part of this event, but unfortunately he has come under illness today and will be absent, but we very much appreciate his effort on our team as well with regards to this development of these recommendations. Along with that, friend of the show, Mariah Maddock, partnership and engagement lead with N4. Mariah coordinates much of the community practice working group and co-authors many of our N4 reports and does a fantastic job doing it. And we'll discuss the recommendations as well today. Thank you everybody for coming. Today's session is being recorded and will be uploaded to our N4 platform. We'll share this with you as soon as it becomes available. Should there be any technical issues during this presentation, we will inform you with details for an alternate makeup session. And before we begin today's event, I would like to take a moment to introduce you to our platform features to help enhance your participation experience. Throughout today's session, we invite you to write your questions in the Q&A window. We know that sometimes many of you might have the same questions or be interested in a particular response. And today you have the option of upvoting questions. Please upvote questions you're interested in hearing the answer to, and we'll prioritize which questions we pose to the speakers first. Now, And with that said, let's jump right into today's presentation. I will now pass the virtual podium over to our presenters. Take it away.
Great. Thank you so much, Andrew, for those introductions. And I just want to acknowledge as well, Dr. Edward Cruz was able to join us today. Edward is the assistant professor with the University of Windsor and also has been a co-chair of our internationally educated nurse working group that developed concrete and actionable recommendations to improve the pathways to licensure. So thanks so much, Edward, for being here. And for the very first time today, we'll be sharing key findings
We may just be experiencing some technical difficulties, so if you'll just bear with the N4 team as we sort this out, and we'll transition to our backup presentation. Thank you.
We also have Christine Corey as well, one of the main leads on the N4 team as well, who's here to as well be a backup just in case Mariah is still frozen. Are you still there, Mariah?
I'm still here, Andrew. Thank you.
Okay.
Apologies,
All right.
everyone. And I'll just jump right back in. So for the first time today, we're sharing recommendations from N4's report welcoming internationally educated nurses into the Canadian healthcare sector. We will officially release the report towards the end of the webinar. There'll be a link in the chat, but we'll also be circulating it so it comes right into your inbox. And some of you may be familiar with N4. For those of you who are not, N4 stands for National Newcomer Navigation Network and is a national network for the diversity of providers who assist newcomers in navigating the complex Canadian healthcare and social service systems. The mission of N4 is for all the vision of N4 is for all Canadians to have a consistent and equitable experience with navigating the health and social service systems during their settlement. And how do we do this? We've created a national platform for newcomers serving professionals to connect, learn, and collaborate around system navigation. The N4 network, on the next slide, you'll see a big map. It's made up of professionals from the health sector. This includes physicians, nurses, social workers, physiotherapists, occupational therapists, in other health professions, including internationally educated health professionals. There's also several umbrella organizations such as settlement organizations and national professional associations for health professionals. They're very instrumental in helping spread the word about N4 and our educational offerings. We also have social services, part of our network that includes settlement organizations across Canada and those in academia. N4 plays a really key role in supporting our subject matter experts to put their knowledge and research into practice. And our network truly spans coast to coast and sector to sector. There's currently over 1,300 professionals across Canada who are members of N4. And N4 has 3 streamlines. We have our connection streamline, our learning streamline, and our collaborate streamline. And there's various tools that can be accessed in each of these streamlines. Today, I'll be focusing on speaking about our community of practice, which falls under our collaborate streamline. And this is one way that we convene stakeholders from coast to coast and sector to sector to come together and work on short-term, time-limited projects that have very clearly defined deliverables. And so Canada is facing a health human resource crisis. And we know that labor shortages, difficult working conditions, and the growing needs of an aging population have strained our healthcare system. And there's certainly mounting pressure on the Canadian healthcare system to fill labor market gaps. We saw that the COVID-19 pandemic exacerbated existing challenges in the healthcare sector and caused a shortage of healthcare workers in all health professions. Yet, despite being highly skilled and valued as immigrants, Canada's newcomers experience significant challenges gaining employment within their international field of study, even when their profession is in demand. And among Canada's foreign-born and foreign-trained nurses, a staggering almost 62% are not working in their trained profession. Improving the pathways to licensure for internationally educated nurses has been identified as a key strategy to address Canada's physician shortage and fill labor market gaps. Beginning in April 2022, N4 received an expanded mandate to look at ways to improve the pathways to optimal employment for internationally educated health professionals. And we leveraged our community of practice structure to convene interest groups in real time to discuss how we could improve these pathways. And initially, we started focusing on internationally trained physicians and internationally educated nurses. As we know, these are 2 of the health professions in the greatest demand at this time, but we recognize that there is work to be done with the other health professions as well. And so N4, initially we began doing outreach and engagement, and we recruited members to join a working group to develop concrete and actionable recommendations that would improve the pathways to licensure. We also wanted to make sure that the voice of lived experience was central in the work that we were doing. So in addition to having the voice of lived experience on our working group, we also formed a consulting group of 2 consulting groups of internationally trained physicians and internationally educated nurses. And our internationally educated nurse consulting group was truly invaluable in the process of the recommendations that we'll be presenting today. We met with this group in between our regularly scheduled meetings. They would validate some of our discussions, but more importantly, also tell us what we were missing. And their voice will definitely come through in some of the recommendations that we're presenting today. And we're also very pleased to have Jennifer Lopez here, who was the co-chair of that working group, or the consulting group. And so following engagement with over 100 organizations, those included regulatory authorities, national professional associations, those in government, those who provide navigational support, including settlement organizations, those involved in credential assessment and recognition, those in research policy and academia, including faculties of nursing, bridging programs, and employers. We recruited members to join a working group. And we tried to ensure our working group had representation from coast to coast. We also strived to have organizations who played a role somewhere in the pathway to optimal employment for internationally educated nurses. Because we were taking a national approach to this issue, where possible, we strived to have a national organization that would represent several provincial organizations. So, for example, it wasn't feasible for us to have all the schools of nursing represented on our working group. So we had participation from the Canadian Association of Schools of Nursing. And altogether, we had a total of 18 organizations and just over 20 members, part of the Community of Practice Working Group. And on N4's consulting group, we also were looking for a diversity of experiences among internationally educated nurses who are living in Canada. And so we had 11 IENs from across Canada, and several of them, some had become licensed, others were trying to become licensed and registered to practice, and others were newly arrived to Canada. And they're from those 11 participants, some of the countries of origin were the United Arab Emirates, Nigeria, Taiwan, China, Syria, Morocco, Peru, the Philippines, and Ukraine. And so following our recruitment period to our working group, we began having regularly scheduled working group meetings while meeting with our consulting group along the way. And initially, we started off with understanding what the current state looked like for internationally educated nurses who were living in Canada and trying to obtain licensure and practice. And we also began validating what some of those key barriers were, but doing visioning towards an ideal state. So we considered what that would look like. And based on that information, we were able to begin to form some recommendations and do a bit of an analysis of those recommendations. So we considered who would need to be involved in implementing recommendations. Were there any implementation considerations? We then developed some action plans for recommendations for what they would look like in practice, where possible with the recommendations that we'll present in a moment. We tried to make linkages to promising practices that we found across Canada. And then we concluded with developing a communication strategy for how we would communicate the recommendations, and also discussed knowledge mobilization, so what we could do to promote uptake of the recommendations in our report. And now I will pass it over to our working group and consulting group co-chairs to present some of the key findings and recommendations. Altogether, there were 22 recommendations that were formed. And on the next slide, you can see the 8 key themes that these fit in. And within the recommendation report that will be shared following the webinar, we made sure to describe a target audience for each recommendation, as well as key interest groups. And where possible, we made linkages to promising practices across Canada. And I'll hand it off to Jennifer to start us off with presenting the recommendations that can be found in the report.
Hi, everyone. Welcome to our first webinar. So our first recommendation is to optimize pre-arrival processes. So we have observed that many IENs faces barrier when they come to Canada in the licensing processes. So this is due to the lack of clear and up-to-date information prior to their arrival in Canada. So accessing the steps to the process to the becoming a nurse in Canada will support and prepare them better for in the future. And along with this one includes the language proficiency test, the online orientation that they could have done prior to coming to Canada. So there are many confusions. There are actually marketed online or virtual platform. However, there should be a single one process that should be offered to any IENs who is migrating in Canada. So along the run of this recommendation, we further say that increasing the support of IENs so that they understand what's the steps and requirements in the licensing or licensure process can be completed pre-arrival. That would help them a lot. And we furthermore encourage that there should be a creation of a single non-clinical orientation course for IENs approved to migrate to Canada that can be accessed virtually. Now we have so many virtual platforms that will be the best option, right? And in the long run, that also orients them in the context of Canadian healthcare system. So some of them even say that, why are my IEN friends in Australia or in Ireland are nurses already? I'm here in Canada and yet I am struggling. So those were the voices that we heard. So with our recommendation, we aim at increasing support with the orientation course. Further down, Joyce will continue.
So, as Jennifer mentioned, one of the key things is reliable information. IENs, employers, regulators, nurses are seeking accurate information about the steps to licensure. What are the processes? What are the costs? What are the financial supports? How long does it take? How likely are you to be successful? Unfortunately, the accuracy and relevance of these sources are, they vary greatly and they contradict one another. Information about the immigration and licensing processes are siloed. They're difficult to understand because they're not written in plain language. And they don't use terminology that's defined. Furthermore, the pathways are different in many jurisdictions in Canada. So for new arrivals to Canada, this complicated process with fragmented and unclear information, IENs really struggle with confusion, errors, underemployment, and a long time to get licensed. One of our IEN members said, it seems like every day I get a notification that the pathway has changed. How are we supposed to stay informed and know how to navigate the system? So our recommendation is a central national hub of information that reflects the current state of the pathway to optimal employment in a user-friendly format. So it deals with both immigration to Canada and with licensing.
As we move along, the third one is to improve access to IEN navigation support. So after immigrating to Canada, IENs are often left to navigate the complex pathway to licensure on their own. They're very unaware whether the navigational support exists, on how to access them. So like me before, I hop in from one library to another, from community center to another. So that's why I am here to impart all the navigation support. So what happened is that each situation of an IEN is unique. You might have different education background, experiences, the proof of language proficiency, or even finances. So thus, the navigational support for IEN is best delivered by those who are expert in their own backgrounds. This is regarding all, even to optimize their employment, right? Furthermore, IEN should not be expected to find provincial IEN navigation support for their own. While the IRCC, or the Immigrant Consultation of Canada, should implement a soft handoff to navigational support who identify as IEN within the economic immigrant or refugee system. So at the beginning per se, they know already that you are a nurse, and they should put you on a stream wherein all the resources is in there. So what we can recommend is that there should be a one-to-one IEN specific navigation support in its province. And that also, there should be as an established referral pathways to IEN navigation support. So when we had the IEN consulting group, one IEN even said, I felt like I was lured to Canada with false promises.
Thank you very much. The fourth recommendation that we have refers to standardization of license. What we found is that there is a lack of standardization of the processes and requirements for IENs to become licensed across Canada's provinces. As one IEN we spoke to said, why are there opportunities for IENs in some provinces and not others? As a newcomer, standardization would make settlement easier. As off-right rules in provincial legislation would support IENs who have obtained licensure in another Canadian jurisdiction to immediately begin working in another while awaiting the processing of their request for licensure in their new province of residence. Currently, only Ontario and Nova Scotia are the provinces in Canada to introduce the rules that permit registered nurses who are licensed in another Canadian province or territory to be eligible to practice immediately with no additional requirements. Recognizing licenses from approved jurisdictions would support IENs whose entry to practice competencies are comparable to that of the province in which they wish to be licensed. The Nova Scotia College of Nurses recently introduced changes that will recognize licenses from the Philippines, India, Nigeria, the United States, the United Kingdom, Australia, and New Zealand. These changes will take effect as of May 1st this year. Registered nurses who demonstrate good standing and good character and are currently licensed in these countries are eligible for registration and licensure in Nova Scotia immediately. Similarly, as of April 4th, Changes have been introduced by the College of Registered Nurses of Alberta that further extends recognition of competencies of IENs registered in Jamaica and Ireland. So we are recommending to adopt as of right rules within all provincial legislation, create a pan-Canadian nursing license, and recognize licensures from approved jurisdictions. Over to you, Joyce.
Thanks. The National Nursing Assessment Service is currently undergoing change. They are looking, and they participated very actively with us in looking at our services and what we're recommending. We really came up with a number of recommendations that they are already working on, but we're not there yet. So aligning the assessment and immigration process, because right now people need to submit the same documents several times. They need to submit the original documents. It's a very costly process. NNAS is planning to be able to issue a single report which aligns an IEN's qualifications to the different nursing professions in Canada. So are they best qualified to move forward with licensure as a registered nurse or a licensed practical or registered practical nurse, rather than going through multiple processes? They're looking at validating the foundational competencies from some of the top countries for immigration, so that nurses don't have to go through individual assessments, similar to what Edward mentioned earlier as processes in various provinces. And in addition, NNAS is looking at being able to refer IENs directly to clinical skills assessments to reduce the wait times. So streamlining and simplifying the process to move people through.
Another recommendation for us is to expand pathways to practice. So many IENs actually are underemployed doing the survival jobs, you know, the healthcare aides, personal support workers, and even sometimes environmental services. IENs who would like to become licensed to practice among their workforce, however, they could leverage the intra-organizational communication methods such as virtual and physical notices to encourage staff to self-identify and have supports in place to help IEN become licensed to practice as a nurse. So there are only some provinces actually who are having the temporary license to include IENs. That's one of our recommendations actually. And some provinces, which is like here in Ontario, one of the recommendations was the Supervised Practice Experience Program. And we believe that offering all this one to provinces and all practical setting would also benefit to all IENs. And you see, one of the IENs even says, I can adjust to anything. I just need opportunities. Back to you, Edward. I'm sorry, this is still for me. So as we also notice, many IENs now will also benefit from the recommendation. We can develop more mechanisms to identify on board underemployed IENs working on healthcare rules and set them to pathway to nurse licensure, even for our IEN, RN, going to RN or RPN. Next slide, please. This is for Edward.
Thank you, Jennifer. We would now like to talk about bridging programs. Following credential assessment, an IEN may be required to complete a bridging program if there are differences between their international education and Canada's nursing curriculum. A hybrid of virtual and in-person formats promotes access while maintaining the compulsory in-person clinical components. This model enhances access for those in rural, remote, and northern communities, and those who have yet to immigrate to Canada. The financial cost of bridging programs was identified as a barrier to IEN participation. The tuition costs of bridging programs across the country varies, with some programs costing upwards of $18,000 per year. We recommend to expand access to bridging programs by offering program elements online, provide needs-based financial supports to IENs to remove barriers to participation, and facilitate opportunities for clinical placements within bridging programs. Additionally, next slide, please. We also noted a lack of clinical placement within IEN bridging programs that does not support IENs with applying the skills they are learning in a supervised practice setting. Bridging programs should universally be responsible for any clinical placements, much like nursing programs are responsible for finding student placements. Furthermore, bridging programs are currently developed independently with wide variety among duration, costs, content, and wait lists without a clear and centralized list of programs. IENs reported enrolling in programs such as master's level nursing or healthcare leadership degrees or certificates being marketed as graduate certificates under the assumption completion would result in licensure, only to realize their investment has not brought them closer to that goal and has contributed to a loss of recency of practice. In 2018, the Canadian Association of Schools of Nursing worked with Health Canada and an IEN task force to develop accreditation standards for IEN bridging programs. Currently, the accreditation standards are under review. We recommend to facilitate opportunities for clinical placements within bridging programs and to implement mandatory accreditation standards for bridging programs. Over to you, Joyce.
There are numerous issues in language tests. Which tests are accepted in various jurisdictions, which tests are accepted by certain organizations. The validity period for most of these tests, according to the testing organizations, is 2 years. It takes an IEN longer than 2 years to become licensed to practice. And when I met with IENs in Manitoba earlier this winter, one of them shared with me that she was about to complete her language testing for the 4th time because of the time commitments that she had gone through in becoming licensed. Raised the issue with the College of Nursing, and there have been some changes made to language testing in Manitoba. But we have some recommendations across the country, aligning the language test requirements and exemptions across all the bodies. So nurses can pass the tests, they know what's going on. Removing the expiry dates of language proficiency tests for individuals living in Canada, and this applies both for IENs and in some provinces also for Canadians where language tests need to be completed as part of licensure. and align the test requirements and exemptions across the regulatory bodies so people can understand what is happening. So these are the 8 sets of recommendations we have. I'm going to pass it back for discussion of the next steps in the process.
Great. Thank you so much, Joyce, Jennifer, and Edward, for that excellent overview and snapshot of some of the recommendations that can be found in the IEN recommendation report. So we see that as chapter 1 of this work. We'll now be moving ahead to the next chapter of this work, which will look like distributing the report. So we've developed a communications plan to get the word out and spread the word about the report. We encourage any of you on the call today to definitely share the report among those in your networks. We'll also be sharing the report through other channels, as well as doing one-to-one meetings with those, some of the target audiences that are outlined in the report. We also, before we don't like anything to just live on our website, we want to communicate what's the contents of the report to those who might be able to action some of the recommendations, and we want to ultimately see them into practice. So we have been developing a very comprehensive knowledge mobilization strategy. And this strategy is looking at each of the recommendations in the report, identifying who the target audiences are, what work is currently underway in the area of the recommendation. We will then be identifying what are the key messages and in what ways will we be communicating the recommendations to those target audiences. We also had our working group members complete, or they will be completing, an ease of implementation and impact for each of the recommendation. And we'll be looking at that data to identify which recommendations we might start prioritizing for our knowledge mobilization plan. We'll also continue to do quarterly meetings with our members of the Internationally Educated Nurse Community Practice Working Group. We want to update our members on our knowledge mobilization of these recommendations. And we also want to stay abreast of the changes across Canada. There's certainly been a lot of changes in each provinces. There's different strategies being implemented by the provinces and in territories, and we want to stay up to date on those. And of course, that will have implications as well for how we're communicating the recommendations and doing that knowledge mobilization. We'll also continue to meet with our internationally educated nurse consulting group members as well on a quarterly basis. And in addition to that, we'll be doing one-to-one meetings with some key interest groups that are listed in the target audiences to discuss the recommendations in greater detail. And I also wanted to point out some other work that's come out of our community of practice. When we did our outreach and engagement, we collected a significant amount of data from around 70 different virtual connection calls with organizations across Canada. And with this data, we prepared a report that explores some of the key barriers and facilitators that internationally educated health professionals experience on their path to licensure in Canada. And this report provides a really great snapshot of the everyday realities of frontline and lived experience professionals at this current point in time. And this is available on the N4 website for download. And another part of this work looked at the employer perspective on what were their needs as it related to recruiting and retaining internationally educated health professionals. So we did outreach and engagement and virtual connection calls with several organizations across Canada, in hospitals, in community health centers, in long-term care. And with this, we were able to find out what were some of their needs. We also developed and identified some promising practices, which we've curated into a toolkit for healthcare employers, things that they can do to recruit and retain international experience. Because we know after an IEN obtains their licensure and becomes obtains their licensure, employment is the next step in that pathway. And here are our emails as well. If you have any questions directly related to the report, feel free to reach out to N4 directly. As well, there is the emails of those who co-presented today. And with that, I will pass it back to you, Andrew.
Thank you. Thank you so much. So I'll leave it up there for just a second before I jump into the questions, but we do have some excellent questions that have come in. So I will stop sharing and I will pop open the Q&A box for everybody. And thank you again, Jennifer, Joyce, Edward, for all being available to present on this topic today, along with Mariah, with these excellent recommendations. So first off, we have a question from Ruth Lee of the Care Center for Internationally Educated Nurses Pre-Arrival Supports and Services PASS program. Our challenge is to reach IENs who are coming to Canada and take advantage of it. Everyone's generous support and spreading word and much appreciated. So great work again from Ruth Lee, and thank you so much for that. Now we'll jump into the questions themselves. What changes have we seen in English and French Canada for IEP nurses? Seems like Quebec is going to significant lengths to recruit more nurses from Tunisia, Morocco, and former French colonial countries within Africa. Have we seen English Canada going to such lengths?
I can start out for this question, Andrew, and then I'll just invite Joyce, Edward, or Jennifer, or Christine to add on. So we have seen, I think this ties so well with one of our recommendations, which is around recognizing licenses from approved jurisdictions. And as we were looking into this, we did become aware of some efforts underway by the Nova Scotia College of Nurses. They recently did introduce changes. They're not in effect yet. They'll be coming into effect as of May 1st. But these changes would recognize licenses from the Philippines, India, Nigeria, the USA, the UK, Australia, and New Zealand. And that would be for registered nurses who demonstrate good standing and good character and are currently licensed in these countries and eligible for registration in Nova Scotia.
Thank you.
I'd add that there have been some recruiting missions from various provinces to international countries. One of the issues that raises for us is actually the ethical recruitment of internationally educated nurses. It's a very different thing for individuals to want to immigrate to Canada and to go through a very lengthy process to become registered in Canada than it is for our government to go looking for IENs to come to Canada and still having some of the barriers in place to prevent them from getting their license in Canada. Edward, you wanted to say something.
Thank you very much, Joyce. I very recently came back from a trip to the Philippines, and in speaking with a couple of the nursing leaders of the country, they have expressed strong concerns over the way Canadian provinces have been sending recruitment missions to the Philippines because it is depleting the country of experienced nurses. Because honestly and truthfully, who would the Canadian provinces be recruiting? Most likely the experienced nurses that they have. And Canada, unfortunately, the Philippines is among the top choice countries where Canadian provinces send their recruitment missions. And it's a struggle. Although the Philippine government supports it because of the dollar remittances, it doesn't make it right when we are taking away from other countries that also require the services of these nurses.
Go ahead, Christine.
Yeah, and maybe I'll just build on that. Totally agree with the previous speakers that this is an ethical issue. There is the World Health Organization has ethical standards around recruitment. Canada has signed on to those standards in principle, but we do, and basically those standards say do not purge from other countries, and you're just creating a problem for those countries. And so we see these recruitment missions as not aligned to those ethical standards. As well, we know that less than 40% of nurses who immigrate to Canada are successful in becoming nurses. So less than 40%. So 60% are unsuccessful. And we hear heartbreaking stories about having been lured to Canada, convincing their families to move to Canada, saying, I will become a nurse, will have a better life, and then only to find themselves working at Tim Hortons or other environmental services or otherwise, a brain waste. So we really need to think twice about any recruitments that we're doing and really focus on breaking down the barriers to people actually, those who are here, becoming employed. We recently heard this week from BC that they put out a call for interest for IENs in their province and had 19,000 come forward saying, I would like to become an RN. We don't need to recruit, we need to fix Canada's problem.
Truly agree with you.
Of course, yes. And to our next question, what role can nursing unions play in facilitating the process support for IENs in their licensing journey?
Maybe I'll take this one as a starting point. Unions can play a role, although much of their role is usually for those who are already licensed as nurses. However, they can play a role in public awareness. They can play a role in encouraging nurses who are employed in the health system to precept and mentor internationally educated nurses. They can play a role in supporting and encouraging clinical placements for bridging programs. We mentioned earlier that clinical placements for bridging programs are a significant issue. So there is a role for unions in working on this. There's also a role for them from the ethical and fairness perspectives to advocate for individuals to be treated fairly and equitably in the process.
I'd also add that, once they're in the workplace, we hear an incredible vulnerability. They are so grateful to be employed, but at the same time, we're hearing about very strong experiences of racism, of discrimination, and not feeling they are aware of their rights, afraid to speak up. So I think the unions can really look at, we all have made statements around equity and wanting to do better since the social justice movement of 2020. That's a concrete way that the unions can step forward, is really targeting and understanding that newcomer nurses are an extremely vulnerable population. And so doing specific reach outs, I think, with organizations and saying, who's an IEN, we want to talk to you, we want to make sure you understand your rights, would be really helpful as well.
I just wanted to add to what Joyce and Christine already mentioned. Perhaps unions can also help educate the members on how to best support internationally educated nurses, because they do need support. And sometimes we also know from the literature that what's happening in our desire to fill in gaps is we just put in an IEN onto a unit without actually supporting the nurses on the unit learn how to support those IENs. And that's an important piece of the transitioning IENs into our health workforce.
Thank you. Yeah, that was excellent. With regards to next question, do many countries that IENs are educated in, do many of the countries that IENs are educated in also have regional provincial differences in their licensure? or are they most often licensed at a national level?
I can answer that one. In Philippines and in Saudi Arabia, there's only one national level for licensure, as opposed to many provinces licensure here in Canada.
Okay. So it would depend on the country in which they're from.
I believe in most countries that I've talked to, there's only one national level licensure.
Yeah. I believe Australia used to have provincial healthcare, much like Canada has, where we're provincially funded. They ended that a few years ago because of some of the issues we're seeing, and now have a national health coverage, national licensures. And so the US is based by state. You get a state license, but it seems to be a Canada and US thing. But UK as well has a single licensure. It's another country. India, where a lot of nurses come from, is a single license as well.
Thank you. What are the most effective ways that you were able to get buy-in from regulators to be open to changing their processes?
I think we can follow the lead of the Nova Scotia College of Nurses as they decolonize their processes in registering internationally educated nurses. I think that's a very positive step to be considered by other regulatory bodies. Because for the most part, we have been coming from a deficit perspective, especially for those internationally educated nurses coming from developing countries. We view their work, we view their credentials as being not equivalent immediately to Canadian nursing education standards, primarily because they're from developing countries and not for something more valid than that.
Thank you. Now, harmonized licensure is a priority of the federal CNO. How was this work connected to the office of the CNO and the federal work that's underway?
I can start for this one. So throughout our process, we did connect with CCRNR, that's the Canadian Council of Regulated or Registered Nurses, and we connected with the president because we know that that council represents the regulatory authorities that are in each of Canada's provinces. And I think that work underway certainly connects to our recommendation around creating a pan-Canadian licensure. What we heard from CCRNR was that they reported that the first step in this process underway is the implementation of a unique identifier or number of each nurse, which would help to facilitate an understanding of the state of the licensure for each nurse in Canada. And they also shared that this needs close collaboration between the provincial government and regulatory authorities for the implementation of this. And we'll certainly be following these efforts as they unfold. That's definitely a priority for N4 since it connects so well with this recommendation.
Thank you. Go ahead, Joyce.
I think what I'd like to add to this is that this is a really good example of how there are many individuals and groups looking at the same issues, concerns, and problems. I got involved in working with N4 because of my interest and passion in helping IENs be part of the system. And in my role with AR&M, had the opportunity to talk to Dr. Lee Chapman as the CNO, who was also working on this project, but from a different lens. And so I see part of our responsibility as leaders is connecting one another. And I did put N4 and the Office of the CNO in touch with one another so that the recommendations from both groups could follow and understand. But it is crucial in this that we look at all the different groups that are involved, because from an immigration perspective, there is one perspective, from a professional nursing perspective, from a provincial perspective, a federal perspective. There are lots of people involved, and we need to be sharing and encouraging groups to connect with one another.
Excellent point. Thank you. Thank you for that. And one final question. With regards to the urgent need of nurses, what are your thoughts related to licensing being funded or reimbursement, or any sort of processes that have been considered or in place within various different provinces?
In Ontario, there are underway processes for this one already.
I think generally the IENs would cheer with joy. The provinces would be challenged by their Canadian nurses to put up their hand and say, me too, please, as you know, new grad nurses do all their licensing. So there's an equity issue for them to look at and talk about need, and really see who's in need and facilitate that. But I'm sure the IENs would be very supportive of any financial supports they can get, and not having to pay, you know, some of these recommendations have implications, right? So every language test you take, for instance, has a fee incurred, and writing the licensure exams have fees incurred. Some bridging programs charge quite a bit of money. And as well, there are players in the space that promote courses that don't lead to licensure, but IENs are misled and take some kind of leadership courses thinking, oh, great, I'll become a nurse, only to discover my $18,000 hasn't led me any closer to licensure. So I think there's a lot of financial issues in this space. And there's also micro lenders that are available, but not well known to IENs. Again, you know, there's a very much a push towards immigration. And then it's like, well, good luck. I'm sure you'll do fine. And so IENs are left to their own devices. And we really need to provide more support and doing that soft handoff from immigration to people who can really support these IENs in finding their ways and being efficient within that pathway, and so they don't have to lose their recency of practice or their language tests and so forth.
Thank you. Thank you. Thank you. Excellent points all made. And with that, before I jump into the wrap up, are there any final points or comments that our wonderful presenters would like to make before?
I just want to say thank you to our co-chairs who are joined here today, and thanks Christine as well for joining the Q&A, and also to all the organizations and consulting group members who participated. Their names are listed in our internationally educated nurse recommendation report. I think moving forward, we truly need that multi-stakeholder approach as we look at implementing these recommendations. And I encourage you on the call to check out the report because there's a lot more detail than we were able to share today with each of those recommendations.
Thank you. And yes, it has been, the link to the report is in the chat box. And with that, thank you, Colleen, for that. And also thank you very much to Joyce, Jennifer, Edward, Mariah, and Christine for taking time to participate in today's discussion. And many thanks to you, the audience, for joining us and engaging with us with many wonderful questions today. You're very much welcome to join us for any of our upcoming events as well that are here and can be accessed through the QR code present. And if you missed any part of today's presentation or would like to watch this session again, we will be posting a recording to the N4 platform within the next week or so. We want to continue the dialogue that this presentation started, so any of our questions that we did not get a chance to address, we'll bring them to the posting on our website as well. And we very much will invite our panelists, our presenters, to respond to your questions there. We also have curated several resources, including the reports mentioned today, with the recording, and they are in our resource toolkit and will also be shared with the recording itself when the email is sent out. So if you haven't yet, please sign up to newcomernavigation.ca for all our resources and learning opportunities. And following today's session, you will be invited to complete a brief survey to share your feedback with N4. These surveys help us continuously improve and seek out new webinar content and opportunities that are responsive to topics that you're interested in. And we kindly ask that you follow the link and complete this brief survey. Along with that, feel free to check out our N4 mobile app that's available on Apple and Android devices through the QR code here, or by going to newcomernavigation.ca/iOS or Android. Thank you again. Thank you so much again, Mariah, Jennifer, Joyce, Edward, Christine, and thank you everyone for joining with us. And we look forward to seeing you at a future N4 event. Stay safe, stay well, and take care, everybody.